The medical team. When Tola got to the specialist clinic entrance, she was directed to take a seat in the area called Reception Outpatients. This is the area where patients register and collect their hospital cards as well as make payments. She was pleasantly surprised by how neat and large the reception area was, and soon her card was issued. The receptionist explained her options concerning the mode of obtaining the card, and in Tola's case, she paid for the card to speed up the process. After obtaining her card, Tola went to the relevant department and waited in the executive waiting room until she was called. After she was called, she went into the consulting room and was greeted by everyone. The specialist and especially the front desk staff, who were really warm and friendly. Tola did not stay in the consulting room for too long, but was informed that she would be skipping some procedures since she had had some blood tests done elsewhere and brought the results. Meeting Dr. O. When Tola was called, she walked into the consulting room and saw smiling faces all around her and a person who looked no older than 30 and yet had the word doctor pasted on his name board. Tola thought she might have had a look of utter disbelief or discomfort on her face because the consultant laughed and said, "Please do get comfortable." Tola replied, "Thank you, doctor, but I need to clarify something. Your name board says Dr. O, but I have been referred to someone else. Do you have a senior?" Dr. O laughed again and said, "Yes, doctor. I welcome you to my clinic and thank you for your curiosity. I am it for today, but I am capable of handling your matter. And my initial stands for Otunba, which is my family title. Otunba means someone who has respect." Tola was amused. She did not recall anyone introducing themselves to her as Otunba, a name she only ever heard associated with money and power. Dr. O said, "Can I have your letter, please?" Tola handed him the letter and he read it through before saying, "Yes, I am aware of the case. I have had a discussion with your referring doctor and I have seen your reports. The problem is that we may end up doing your laparoscopy at St. N. I was also hoping to have another look at your HSG test. Have you had one?" Tola answered that she had, but that she had an earlier film. Dr. O processed the film and showed it to Tola. Tola did not know what to make of what she was seeing, but something told her that the uterine contour was all wrong. Dr. O said, "Please go on to the examination table and I will look at you. You can talk to me about what you see." Tola did as she was asked. Dr. O asked if she had pap smear reports. Tola said that she did, but that they were old since she had not had a repeat smear for the past 2 years. Dr. O asked Tola to lie down for a pelvic examination.